Hello and welcome to another episode of Social Workers in Policy. We are here to explore non-traditional roles that allow social workers to elevate their impact to the systems level. I'm your host, Melissa Winarowski, fellow policy social worker, and today we're going to be discussing, throughout the series, we're discussing a wide variety of social work careers with social workers who have found non-traditional positions at the macro and various policy levels in academia, government, nonprofit, corporate, even technology, philanthropy, and more. We are here to illuminate the path for those who might want to move their careers to the systems level and are actively seeking to figure out what are their next steps and determine how they could get there. For today's episode, I'm going to introduce you to Lanelle Quzack. Lanelle is a social worker whose career has evolved from direct practice into research and systems level work. She is currently a research coordinator at a pediatric hospital in Philadelphia. She supports qualitative research and quality improvement. She's passionate about using research to promote social justice and equity. She recently began mentoring social workers who are interested in research careers and led her institution's Research Day, highlighting research pathways for underrepresented minorities. Lanelle is a PhD candidate in social work at Widener University, where her dissertation focuses on community-centered research and decolonial approaches, where we can explore ways to challenge traditional power structures and center marginalized voices. So we are so excited to have Lanelle with us today. Lanelle's bio is in the show notes below if you want to read more. You can like and subscribe to make sure that you don't miss any future episodes. And if you really want to stay connected, there's also a link in the comments to join my email list. That way you can get all of the updates and information directly to your inbox. And in addition to this channel, we're also going to be exploring some other supports for you as well and resources. So stick around and join us if you don't want to miss out. In the meantime, we'll go ahead and get into today's episode and welcome Lanelle.
Well, hi, Melissa. Thank you so much for having me. I'm so happy to be here today.
Awesome. Thank you so much for being here. I'd love to just get started by hearing a little bit about your background in social work, where you started out and how you transitioned to where you are now.
So I started out actually graduating during the pandemic, so it was a different time. Started off in child welfare, where I worked as a child advocate social worker in the court system, helping with youth that were dealing with, unfortunately, child abuse cases, having to either get adopted or get placement with other family members. So working in that really opened my eyes to like the family court system. And as I was managing cases, I kind of realized that this is not a micro level issue. This is more of a macro level issue. And what can I do to help? So I really did enjoy working with different clients and different lawyers in the court system, but just knew that there had to be another way to improve this like area. So that's when I started seeking out roles within like research and like trying to figure out how can we get to the deeper root of the issue. And that's where I landed the job in clinical research. And it just so happened that this job worked in the pediatric population, where I felt like I could really make a difference and improve some equity as well as improving some system level issues. But this was just exciting for me to kind of like change into this role, but also a little, I was nervous because I didn't ever work in research before as like a career. I was mainly introduced to research in like graduate school, where I did work as a research assistant in like grad school for social work. But that just felt like something completely different to me. And then stepping into this like career as a professional felt like it was a whole new world. I went into it with a lot of humility, I will say, and like as being a social worker, we all typically try to do our best, but just being open to learning, and also I had to take a moment to sit back and realize that I was capable, and there were so many transferable skills from the micro level in social work that could be brought over to this research side. So instead of looking at it as this is a new point that I'm pivoting at is like, how can I use what I've learned from working in the child welfare system, from graduate school and social work and life experiences overall to transfer that into this research role, and identifying that I bring a different perspective that's appreciated in the research space. So like having that aspect of wanting to be cultural humility and like making sure we're always learning, the aspect of being able to connect with participants and patients overall, I think was a major skill that I brought. So those things, which are kind of like considered soft skills, I think were my strength, whereas things that were more technical, I was able to just pick up on and learn through working with others in the role that already were experienced in research.
I know you spoke a little bit about, just really wanting to have an impact more at the systems level. What was that trigger, or that decision point that made you feel like, okay, it's time for me to do something different?
Like I was on, I want to say at that point, maybe like 40 different cases. And it started feeling very overwhelming. And not overwhelming because I was working with the youth or like the families that I was working with, because that part is such a joy for me. But I started realizing the barriers that existed on a system level, that no matter what I did in terms of case management, they were not going to go away just from me being a case manager in that role. So I kind of like sat back, looked at it like, how can I make a difference on a more macro level? Or how can I even just understand the differences that are happening higher up on a policy level, that led me to making the decision to ultimately look elsewhere.
What were your first steps then once you made that decision?
Yeah, so I honestly I started just applying to a lot of different places that were more macro focused. I think this was my first time being intentional about where I applied to. I think before being like a newer social worker, I was just like, okay, let me get that social work experience. Other than like, okay, let me be intentional about how I'm using my social work degree and what I can contribute. So I think that's what kind of my first step was, like being intentional about what I was applying to, being intentional about job descriptions, and then also as I did apply and did interviews, like not being afraid to ask questions during the interview, of like the person that's interviewing me, of like how can I contribute here, or like what is the ultimate intention of this position? Like is it just to kind of push things along and manage things, or is it to make an actual difference?
Yeah, how did that go during the job interviews, asking that kind of question?
And that was scary. I think, it was a little scary at first to ask that, but I think I realized that, like, if people were turned off by that, then maybe that's not the place that I needed to work. And
Mhm.
also, I think that at least this employer that I work with now, I think that they appreciated that question because they ultimately wanted someone who had the same agenda as them, wanted to make a difference as much as possible, but also like keeping in mind the constraints that we work in, but making sure that I'm pushing things forward and not just doing it just for work's sake.
Once you decided to make this shift and you started looking for more macro level work, what were some of the biggest challenges that you faced in trying to make that shift and move to your next step?
Um, I think the hardest thing for me was identifying what jobs to apply to,
Mhm.
because there are some roles that, as social workers, especially with an MSW, we can fit and are qualified for, but it might not necessarily say MSW preferred or like, what degree is held there. But like just looking closer at, I guess, like what they're asking for in terms of like job postings, that was like a skill I had to learn. And again, with those transferable skills, realizing like, okay, just because I did case management doesn't mean that maybe I don't know how to manage a project or, vice versa. So identifying jobs was one of the harder things. And then I think just for me, like not letting go of that imposter syndrome, I think is the hardest part too. Because a lot of times, like, in school, at least for my graduate program, we were kind of in a way pushed towards more micro careers. It wasn't really spoken about in terms of like what was out there for macro careers, especially in research. So like letting that go and realizing like, the worst I could do is apply. At least I'm getting some type of information from applying, whether that's getting accepted or not. I'm able to take what I learned and can move forward and know how to either tell her my resume or tell her what other things I applied to.
Specifically moving into research, how did you frame those skills and experiences to determine that you were qualified for these roles and decide to apply? I think research, particularly, might be an area where a lot of social workers might feel intimidated. And so, how did you build up and frame those skill sets to fit?
Yeah, I think one, I will not definitely have to acknowledge this. One thing that really helped was that graduateship experience of being a research assistant in grad school. So definitely don't want to negate that. But I think too, the focus on being like patient or client centered really was highlighted there. Being able to build rapport with clients or patients was very like highlighted. And then also just like that I'm a quick learner, like, put me in the space and I'm able to absorb things and can kind of work with that. So I kind of led with like my personality, I guess, is like being open, being willing to learn, being able to build rapport, and also having that like the ethics in mind. And that was very big in terms of research as well, of like being ethically sound and knowing how to like, I guess, be flexible in this space.
You mentioned being a research assistant when you were in grad school. Did you have any other additional training or experience before moving into a research role professionally?
Yeah, I guess actually in grad school, I worked maybe for about like 3 months as like a research assessor. So I was able to go into some Philly schools and interview students, which was really fun. So that was like my first kind of like little job, I would say, in research, and it opened my eyes to like, oh wait, I do like this. So yeah, I think that was another thing that helped. As well as at that point, once I did apply, I was already in a PhD program. So I think I was able to leverage that as well. But before that, I did get that like smaller research job with an MS, but before even having an MSW.
Okay, so even before the MSW, you were already working in research and
Yeah, like
um,
I would kind of find like smaller jobs to see like, do I like this or do I not? And that's when I found out like, oh wait, research isn't just numbers. It's actually something that can be impactful on a policy level. With the team that I'm on, I'm specifically on the qualitative research core team. So we do a lot of consultation-based work where I might be working on maybe 7 projects at a time. So the days can look very different depending on like what project I'm focusing on. So for instance, like some projects come in and it's just like very bare bones. We're starting off with filling out the IRB application to make sure that everything is in line when we begin the research process, through data collection, doing interviews with patients and families, down to data analysis, so like qualitative coding and finding themes for what comes out of those interviews, and then ending off at like making reports and even doing some publications to disseminate that work. So various projects and all of them are at different phases. So some days I'm calling families to do interviews, like doing some type of like tracking to make sure that's up to date. Some days I'm just doing qualitative coding. Some days I'm doing all of the above. And then another part of my job that I am pretty excited about because I get to use some type of like patient-centered skills. So I actually connect families with childcare resources. And that's pretty cool for me considering the times. So I'm able to share some resources with families, and that really speaks to my social work spirit of like just being able to provide some resources and help them along their way. But then it also has the component of wanting to make sure that we're tracking that for quality improvement. So not just doing that for no sake, doing this for a policy level changes.
You talked a little bit about doing some qualitative interviewing. I think those are some of the more obvious fits where those clinical skills would come in handy, the ability to develop rapport with people and get them to talk about their experiences, making sure folks feel comfortable participating and thinking about how their story fits into the larger picture, I think are all very related to some of those more traditional social work clinical skills. What about some of the other tasks you do, like coding or maybe even report writing or other meetings you might hold? How do you see those fitting in with your social work background and training?
Yeah, so for coding, I think for me, that was something completely different than I was used to. But I think for me, I was able to kind of look at it in a social work way of like, you need data to improve programs. So thinking of like when we do coding, a lot of it sometimes is for quality improvement projects. So actual clinical projects that are happening rather in like the social work department or even specifically in our like fostering health department. So that feels very connected to social work for me. And then for like report writing, some of those skills I would definitely say I was able to gain from the graduate experience of like social work, and just like knowing how to format things that'll catch the reader's eyes, as well as like from those interviews providing quotes that are direct quotes from patients or families that are very compelling and like paint the story, so that we're able to continue to get funding for these type of projects, continue to get funding for programs that exist that we want to continue because when it comes to grant funding you have to make a case for why you need that funding, and that's how we keep these social programs going.
Now, you decided to go back and get a PhD in social work, which is great. What about, so for folks who feel like they have to get a PhD, otherwise they can't really get involved in research, systems level, macro policy work unless they get either a PhD or maybe a second master's degree in something like public health or public policy, public administration. What would you say to those folks? And is a PhD necessary, and what led you to that decision?
Yeah, and I would honestly say, like, after I did get this role, it really dawned on me, like, oh wait, I did not need a PhD for this role. Even not even being in school for this role. But it was definitely something that I wanted to do for myself. Just more so like to do more independent research on that level. But I would definitely say you do not need to be in PhD, like to get a PhD or to be in a doctoral level program to get a research role, especially where I work. We have a lot of master level individuals. Specifically, I will say I'm one of the two social workers in my department who do research. Most people have a master's of public health. But again, I think there are ways to leverage those skills that we get from social work to speak to the fact that we can be in this realm and even like talking up like all of the knowledge that we have about being patient centered again. And like, again, report writing, like we're really good writers. I think that us as social workers, we don't really think about the writing part as much. We're more of like focus on that clinical piece, but think about documentation in itself. That's a really good skill for research overall because we have to track everything to make sure that we're doing things ethically and make sure there's a track record of what's going on. So yeah, I would definitely encourage anyone who is interested in a research role to don't be nervous that you don't have like a doctoral level experience. You can for sure still get into this realm with a master's or even a bachelor's. We have some folks who work as research assistants that have bachelor level degrees, and then people that even come to us for like internships and are able to get that experience there. So there's so many different ways to get involved.
What kinds of I know you're working in a hospital right now, so, and you mentioned that most folks are maybe public health background. What specific types of policy issues are you working on right now?
Yeah, so we're working one I can think of is like vision care for foster youth. I'm working on that with the child care navigation project. So making sure that early childhood education is improved and that families are able to get funding for child care if possible. And then there are some other studies that we're working on that range from like more like program based that I think will lead to kind of like policy changes. So like behavioral health things and like how medications are prescribed to youth for behavioral health. And then like some early intervention studies on like developmental delays and autism research. So like there's like so many things that are like coming on the cusp. I don't specifically work on this, but there are some folks working on like SNAP benefit policy level changes. Yeah, there's always something going on. And even there's opportunities to speak at like City Hall or like Capitol Hill for these things. So very excited to see, like, I know for me, I'm a pretty early career person, but just excited to see what will come and like in terms of advocacy in this space.
When you moved into research as a social worker and you're surrounded by folks who have maybe other degrees from other disciplines, what are some things that social workers can do? What are specific skill sets that they can highlight to show that they are not only qualified for some of these research and policy roles, but actually uniquely qualified?
Yeah. I think again, like that patient being patient centered, that ability to build rapport is definitely important because you can't even get to knowing what people need in the community without being able to speak with them. And I know for me specifically as like wanting to be a community engaged researcher, like that social work experience really came up and it was so important. So like even things from graduate school that I didn't think I would ever use, so like logic models. those come into play when like thinking of program implementation or like program implementation to influence make policy or vice versa. So like those technical skills that we learned in school in terms of like documentation, working with families and communities, needs assessments. That's like the main thing for policy changes because you want to know what needs to be changed. But so much of that background work and even like field experiences, I did a field experience. I did my field placement 1 year at a Philly school. And then from there, again, I was able to kind of see how Philly schools were navigating and think about changes that could impact the youth. And I think that kind of really helped with my experience in that study that included facilitators and barriers for school mental health programs. So I think highlighting like the type of internships that you participate in can be really important because there might be some research that fits in that niche area, as well as just like the overall social work like competencies and a lot of the values that we hold. I think those are really great to highlight because when it comes to some policy level work and specifically research, those are things that are not apparently that you would might need, but I think that they come out once you continue to do that work.
So for social workers who might be watching this right now and thinking, wow, I'd really love to get involved and do something like that. I know I need to make a change at the systems level, but it feels intimidating. What would you say to them?
Definitely do not count yourself out. I had to tell myself this too, and I think sometimes I have days where I'm still telling myself this, but you're more than capable. You have the skills, you have the transferable skills, and if you don't think so, I would say like pick a job posting that you're interested in that might be policy related or research related and really compare the things that you've done in your past or you're currently doing, and I'm sure there will be some type of like cross pollination there, or even ways to talk about how there can be cross pollination and how you can work to fit that role. So I think it's all about looking within and realizing that you're capable to do this. And if not anyone, social workers are more than capable.
And where can social workers find those policy related opportunities? I know you also mentioned when we first started talking here that most of the time these positions won't say social work anywhere in them. They're not targeted for social workers necessarily. So, how can social workers find opportunities?
Yeah, I think some keywords that I think were helpful for me were definitely including the word policy, if at all possible, like program evaluation. There are some like coordinator roles that kind of fit in that realm a little bit. But I think when the job descriptions say things like working like implementation or things like that, that's kind of where you can find those pieces. LinkedIn for me was very helpful, just like using keywords. And then I also did take like an MSW kind of like course, like 1 day. It was like free. It was very helpful for me to learn like how to target and like tailor my resume to fit these roles. And I think that was like really helpful as I continued the journey.
How can someone start building a policy portfolio or a research portfolio while they're still working? If they're still, for example, in a clinical role, are there ways that they can start building those macro level and policy skills while they're still in their current job?
Yeah. And I think that calls for searching for opportunities within the current role that you're in. So maybe there are some programs that are going on, doing things that facilitate some feedback. So like maybe evaluating your like participants or clients. And then from that, some type of report can be generated. And that's something that you can add to your resume, your CV. That's like report writing. And again, that could even turn into some type of grant funding, which, writing grants is a key piece to some like policy level work or research work. And then even just like seeking out opportunities to be involved in like community advisory boards could be helpful. I know sometimes that's like outside of the work hours, but if there is the opportunity to do that at your job, some clients typically appreciate things like that because their voices will be heard. They have a say in like how the programs can be ran. And that's just only going to be helpful for the insight of improving programs at your current employer. So I think that's ways to kind of build that portfolio that could lead to some research careers in the future or policy level changes once people are aware of like what's going on.
How much, if at all, did you rely on things like networking in order to help make this pivot early on?
Yeah, for especially for this role, I did not know anyone at this place at all. Um, yeah, I do wish that I will say like networking is power for sure. So if you know anyone already in those spaces, definitely connect with them and like, or even just, talk to them and see like how they got in that role or how it can be helpful to learn those skills. Cause that's number one. But networking is always key.
Yeah, and even just not looking for specific jobs, but networking to gain some clarity on what it is you want to do and what direction you might want to pivot in. I think sometimes networking can be helpful in that realm as well.
Yeah, absolutely. More recently, I've been getting a lot of students reaching out to me to ask, like, how did you get in this role? And it's been such a joy to just share some type of like experiences or tips that can be helpful. The biggest tip I always give them is like, you're capable, you can do this, you have the skills. And I've like heard them say that I've left so empowered after you said that because I feel like I knew this, but hearing it from someone else is so helpful. So I think that's another thing too. Like once you're in this space, be willing to give back and connect with others to share how you got to where you were going so that other people can do the same thing.
Yeah, and for folks who might feel like I'm intimidated to reach out, intimidated to do some of that networking, maybe I don't know people, I don't want to feel like I'm bothering them or asking them for a job. When folks come to you and are asking for career advice or just to share in your experience and know how you got where you are as a social worker, is that something that I mean, you shared something kind of energizes you and gets you excited, and it's not a burden. It's most people I think are really open to that kind of contact and communication.
Yeah, absolutely. Yeah, I think even if someone's watching this, like feel free to reach out. I think like we need more of us in these spaces. We have so many great skills that could lead and be in this space. So I'm always more than willing to like help anyone or just even be a sounding board if you want to just talk and like get some ideas out there. I think that's what it's all about, just giving back.
Are there any specific volunteer networks or continuing education or other organizations that folks you'd recommend that they get involved with in order to start building those networks and get pointed in the right direction?
There is this one opportunity I know if people are interested in more like research mentorship. There's this place called Research Girl, and they connect people with like mentees and mentors. You can be like in school at every different level, and then you meet virtually. So like that's been one thing that I did sign up for as a mentor. But thinking of like being a learner. Different webs. I guess like if you're interested in research, maybe doing like one of those like city trainings. I know they made us do that in our like MSW program. But that's a great way to get like some insight on like just research background. But no, we need more of that. We definitely do.
Yeah. Any specific continuing education or course that if folks, I always tell folks if you don't want to go back for your PhD or you don't go back just because you feel like you have to, go because you really want to. But if
Mhm.
you don't really want to, what are some other, maybe just take a single course someplace in data analysis, or if there's a specific skill set that you feel like is lagging and you'd like to build up, you can just target that one skill set. What are some areas that you think if folks don't want to go back for another master's degree or a PhD that they could focus on that would really help propel them into this field?
Yeah, and no, I completely agree. Definitely do not go back just for go back's sake.
Mhm.
It's a big commitment. Of course, if you're willing for sure, but it definitely can be a lot. Some resources, I guess I would say when it comes to taking a course, like definitely being able to write. Writing is definitely like king in this space. Like if you can't write it up, then who will know? So yeah, if you are willing to work on improving like writing skills or report writing, I think those are really ideal. Um, One thing I will say, like in this space, especially even like policy, there's a lot of public speaking, to get your points across. And for me, that was so tricky. Like I used to get very nervous. I do not like public speaking, but just taking those opportunities to do smaller things and then build your way up, I think is very helpful. So like for me, I don't like public speaking, but I do it often to improve as much as possible. So if there are ways that you can take like leadership roles, even like at maybe like community settings or like at church or any groups, I think that's a way to gain some facilitation skills and also public speaking skills that could be helpful.
I'd love to just wrap up a little bit here by talking about what it is that you love most about working in policy as a social worker.
What I love, I guess being able to see direct changes really excites me. Um, Like, I think that for me, like, I feel like there's progress in where I work, especially because, like, we don't just do research for research sake. We're doing it for policy changes. We're doing it for to help the communities and also to see what the communities would want. So I think that really energizes me. And then also just thinking about like what is to come because there's always more that can happen and always more to come. So like working in this space has me really excited to work with communities and do my best to listen to them, and also just change the course of like what people think policy work and research is because it can be a very scary thing to some people. So just illuminating that we are all capable to do this and we deserve to be in this space. I think that's what most excites me.
What has been either most surprising or most rewarding for you in this
Yeah.
space?
I've been able to, outside of work, kind of participate in some things. So one of the committees that I led last year, and now I'm like just a member, a part of, but we do a lot of student targeted like advocacy. So making sure that underrepresented minorities are introduced to research pathways and policy careers. So that's been very rewarding for me, just to be able to plan like that research day. That was so much fun. And a lot of students left with like the idea of, oh, wow, I can be in this space. Like there isn't just the technical research career, but there's so many other spaces there. I think that was the most fun of just like sharing the wealth of knowledge, because I just love just like letting people know there are other things out there. There are so many different careers and just opening people's eyes that, they can be in that space.
Yeah, that research day, that was part of your university or that was part of your job?
It was a part of my job. So yeah, we create and back in 2020, a committee was created that's called Visibility and Voice, and we specifically host a lot of like the employers of color. So we decided that it would be a good idea to bring some students in, provide some internship opportunities, but because they already do provide internship opportunities, give them like a sense of like coming there for a day, seeing what we do, some poster sessions, so that they're able to see like what's out there. So it was really cool, very well received. We're on our third year coming up in 2026, so we'll be doing another one. So yeah, definitely we'll share that on LinkedIn if any students are interested.
And is that specifically for social work students or other students in there as well?
So honestly, it's mostly been, I want to say like public health students, but I always send a plug to any social work program that I know. I'm like, we need us there. Anytime we have things, I like share it widely to my social work networks, because we actually have had a lack of social work students. So please come. You're definitely needed. I try my best to like any of like the programs in like the Philly area. I usually send like an email out to, just to make sure that they know like this is not just for public health folks. This is for social workers as well.
What advice would you give to your younger social work self?
I guess I would say don't be afraid to see what's out there sooner. I think like coming into social work and like being a case management at the time, I thought I had to like gain so much more experience before I kind of saw what else was out there. But there's no harm in exploring. Like if you can, I know sometimes there are like, monetary constraints and like things that could be a barrier. But like don't be afraid to get out there sooner, actually see what you're interested in. Like you don't have to be like I guess what they say, like a seasoned social worker to pivot and do something different. Like it's okay to like take what you know at the time and then try something new.
So, where can people find you or follow your work if they'd like to learn more?
Yeah, so I'm on LinkedIn, Lanelle Quzack, but I also do have an Instagram page called Rooted in Qual, where I share a lot of like things that are going on in school. So like some of my dissertation research will be shared there. Some like just community events that I go to and support are on there. Yeah, I'm more than willing to share and connect on any of those platforms. And also either just through email. So my email is lquzack@gmail.com. People are more than willing to reach out, connect, would love to either share, learn from you, just very open to meeting new people and building community.
All right, well, that is it for today's episode. Please drop a note below to let us know what your biggest takeaway was from the discussion. And don't forget to check out the resources linked below. We have a brand new workshop that is designed specifically to walk you through your own step by step evaluation of your social work skills and identify exactly where you can start to make your policy pivot. You can also sign up for the email list, get new workshops and support offerings directly to your inbox as they become available because we have more planned. hand. And remember to like and subscribe so we can see you next time. Until then, take care and thanks for joining us.